Welcome to your TZ Medical Trident Pro application guide. Your Trident Pro monitoring kit will contain the following items: a skin prep kit containing abrasive finger scrubs and alcohol prep wipes, adhesive snap-on electrodes, your Trident Pro monitor, a Trident Pro belt clip holster, a 3-electrode patient cable with a charging port, and a Trident Pro wall charger. Before starting your study, it is important that your skin is properly cleaned and prepped. In the areas shown in the diagram below, remove any hair and thoroughly clean the skin using one of the provided alcohol wipes in your kit. Once the areas are dry, locate one of the provided abrasion pads and remove the release liner, exposing the adhesive. Adhere the pad to your index finger. Abrade the skin by applying pressure with your index finger and scrubbing the area up and down 5 to 6 times. Ensure to abrade all 3 areas where the electrodes will be placed. Clean each debrided area a final time and allow each site to dry for 1 minute before applying the electrodes. Remove the patient cable from the kit and open the pack of adhesive electrodes. Attach each lead to one electrode. Peel the release liner to expose the adhesive and apply each electrode to the cleaned and prepped sites indicated below. Place the white electrode on your right. Place the black electrode on your left. And place the red electrode on your left rib cage, below the black electrode. Power on the device by pressing and holding the button beside the screen. Select the plus button to start the recording, and follow the instructions on the screen. Firmly connect the cable to the device in the orientation shown. An ECG signal will display briefly, indicating that you have a proper connection, before moving to the monitoring screen. Once the device is successfully monitoring, slide the device in the belt clip holster and secure it to your belt or to the waist of your pants for comfortable and discreet storage of your monitor. To record a symptom, press the plus button to display the new event screen. Use the arrows on the bottom left and right of the display to follow the instructions. First, use the up and down arrows to highlight the symptom that you experienced, then select the right arrow to continue. Next, use the same up and down arrows to select your activity when experiencing the symptom previously selected. Click the right arrow again and confirm the event by pressing the plus button and continue monitoring. It is recommended to charge your device for 1 hour each day. To charge your monitor, locate the barrel jack wall charger from your kit and plug it into an easily accessible outlet. Insert the end of the charger into the charging port located at the end of your patient electrode cable. Once connected, the device will begin charging, indicated by the charging icon at the top right of your screen. Here are some important things to remember while wearing your monitor. Once your study is complete, you will see a done monitoring screen with a power icon on the bottom left. Press the power icon and confirm shutdown on the next screen before returning your device. Do not shower, swim, or bathe with your monitor connected. Please disconnect the patient cable from your device before showering and thoroughly dry off before reconnecting the patient cable to resume monitoring. During prolonged inactivity, your monitor's display screen will hibernate to conserve battery life. Press the circular power button on the device to wake the display and access the touchscreen. It is recommended to charge your device for 1 hour each day to avoid complete depletion of the battery. Try to locate an outlet near a chair or your bed that will allow you to rest during the charging process. If tracings do not display correctly, ensure that the colored snap connectors are securely attached to the electrodes and at the proper locations. For assistance with connection, operation, or return of your monitor, please contact us at the number below, and our team of customer service representatives will be happy to help.